Hi, this is Dr. Scott Hoar, and today is Treatment Tuesday, and this week our patient is Karen Arias, who is a fitness instructor as well as a yoga instructor. So Karen, what are you dealing with today?
So for a couple of years now, I've been dealing with lower right side pain, lower back.
Okay. What does the low back keep you from doing?
With yoga, I feel weakness in that right side a lot, imbalance from the left to the right. And then also when I try to do any type of like power lifts, you know, like squatting or deadlifting, I don't feel engagement on my right side at all.
Sure.
So I'm mostly like very sore on my left, you know, in the next couple of days, and I don't activate my right side as much as I'd like to.
What yoga moves or poses or anything like that can you tell the imbalances with?
Honestly, one that really truly impacts me is the Warrior 3.
Okay.
That's one movement that I've realized that just I feel the imbalance every single time, and I just kind of try to breathe through it and not get frustrated. It feels like I'm becoming a little weak in my practice, or maybe weak in the strength aspect of my body, maybe losing some muscle. And then with that comes frustration, and with that comes just a lack of motivation.
Okay, so we went through Karen's full medical history and we did an initial examination. So I'm going to go in right now and check out a little bit further what we should do to help her out today. So, Karen, what I'll start with is motion, palpation, and kind of examining your muscles. Okay, so basically that just means I'll be moving it around a lot, and I'm not going to snap or crack or treat anything yet. Okay, I'll let you know when that's coming. What has your experience with chiropractic been in the past?
All positive.
Okay.
I hope to keep it that way.
Is there anything you're particularly nervous or scared or concerned about?
I will not lie. Every time I walk into a chiropractor's office, I get this nerve-wracking feeling of just my neck, and that's gonna have to be aligned, realigned. Okay. So that's where my nerves kind of come in, just the whole head and neck aspect. So
you certainly have a little bit of nerves regarding getting your neck treated.
Okay.
Okay.
That would be honestly my only concern, though.
That's it's a common concern.
I'm just really excited. Just don't break me.
Okay. Let's get to it. Those are your scaling muscles right there that are real tight. And the neck joints are moving pretty well. We have a restriction right there. So I would like to do an adjustment. Are you comfortable with that?
Yes.
Okay. You ready for the scary part?
Not anymore with that comment.
It's scary for you. I'm not scared.
No, I'm at the beach, just relaxing.
Good. All right. Hated that?
It's a love and hate. My whole body just got really hot.
Yeah. There's all sort of systemic impacts with these adjustments. All right, I'm going to get up a little bit higher on this right side, okay? You're freaking out, huh? Take a deep breath. Let it go. There we go. Very good.
Oh my God. Oh.
All right, so just so you know, that went perfectly. Okay. Take a couple of deep breaths.
My palms are sweating.
Yeah. Okay, so scary part's over. You all right?
Yes. That was really loud. Was it Was it me or was that just really intense?
It was pretty loud, but that is not an indicator of anything. Okay, it doesn't mean, oh, this was
bad
or good, or man, your neck was, you know, it doesn't.
You were fucked up.
Yeah. Okay. Make a fist for me. Good. I'm going to push down into the table. Don't let me do that. Go. Good. Any irritation? No? Okay. Put your thumb and your pinky. Can you open your eyes for me? Your thumb and your pinky. Put them together like that. I'm going to pull them apart. Don't let me do that. Man, you are sweating, huh?
I broke a sweat after that.
Yeah. Are you
I'm
all
fine.
right?
Yeah, I feel great. It's just my body literally felt temperature.
Yeah. It's
right
quite
after the right side.
it's quite a shock to the system. Yeah. All right, thumb pinky, pull it apart. Don't let me.
Ah!
One more time. Good. Did that hurt?
No.
All right. I'm going to pull your elbow over here. Don't let me do that. Ready, go. And again. Ah, very good. Okay. Make a fist for me. I'm going to push down. Don't let me. Go. Very good. Muscle test. I'm going to push that way. Don't let me. I'll stabilize your opposite hip. Ready? Go. That hurt. And where did that hurt? In the
Front
shoulder.
delt.
Okay. I'm going to push diagonally. Don't let me. Go. And that's not good either. All right. So we're going to do a little adjustment to your clavicle here, where your clavicle meets your sternum. So right here. Okay. So I'll bring you over here. And go over here. And this one doesn't feel great. Okay. Good.
So delayed. Ouch.
Okay. Now I'm going to do that same muscle test where I'm pushing out there. Don't let me. Ready? Go. Not good. Okay. Still right there.
Almost now bicep too.
Okay. I'm going to do an adjustment where your ribs meet your sternum. So just a smidge lower. Let it go. Good. Hold it right there. Pushing out there. Don't let me. Ready, go.
Wow.
And there. Don't let me. Ready, go. Much better, yes?
Yes.
Good.
Whew.
All right, we'll go on the other side here.
I think I'm now coming back from just the first crack.
Yeah.
I'm finally coming back from that first one.
Make a fist. Pushing down. Don't let me. Go. And again. Not so good, huh?
No.
Okay, so that's the coracobrachialis muscle. I'm going to adjust your AC joint over here, which is part of that shoulder girdle that you're using during that movement that's really bothering you. So we'll go right here. Good. That hurt?
Mm-mm.
I don't believe you.
It didn't. I promise.
I'm going to push down. Don't let me. Go. There you go. A little bit better, yes?
Yes.
Good. Your thumb and your pinky. I'm going to pull them apart. Don't let me. Very good. Your elbow, I'm going to pull it out here like that. Don't let me do that. Ready, go. Very good. Make your fist. I'm going to push down. Don't let me. Go. Again. And that's a little weak on this side, isn't it? Okay. So that's a little bit of your rib cage and shoulder girdle underneath the shoulder blade here. So we're going to do an adjustment where you're going to put your right palm on your ear. I'm going to stick my thumb in your armpit, wrap my hand around your shoulder blade, get all up in your rib cage here, okay? So take a deep breath. Breathe on out. There we go.
Yes.
Yes.
What a relief.
Okay, good. Make a fist. I'm going to push down. Don't let me. Ready? Go. Again. Ready? Go. Yeah, there it is. That's great. I'm going to push that way. Don't let me. Go. Same sort of deal on this side, huh? And I'll push that way. Don't let me. Good. So lots of rib dysfunction on you, and that's what we're finding.
Where does that stem from?
Gosh, that's a hard question to answer, right? It could be from dancing, could be imbalances from how you moved, could be from bouncing barbells on your chest. You know what I mean? So there's lots of choices. Okay, so I'll bring it over here. Breathe out. Good. Hold it right there.
Ow.
Another delayed reaction there. I'm going to push right over there. Don't let me. Ready? Go. Didn't do it. Okay, we got to get those ribs again. Breathe out. Great. Hold it right there. Okay. Pushing away. Don't let me. Ready? Go. Good. Pushing that way. Don't let me go. Good. So those pecs are firing now, huh?
Yeah.
Good. And I just want to look at kind of how your shoulder moves. Yeah. So I'm releasing your subscapularis. Ooh, it clicks like that, huh?
Every time.
Every time? Ooh.
Is that why that pose hurts so much?
Yeah. All right, breathe out. Let it go.
Ow!
Very good. And it's the one side that's really the worst here. Okay, can you put your chin to your chest? Good. Breathe out. Very good. Got it. What does that feel like?
Weird.
It doesn't cause that pain in the lower right back?
It feels so. I feel really, really tight on the right outside right hip, but then really weak on the inside left or right.
And it's not restricted like that on the other side. So I'm going to do a little bit of a hip mobilization here. There's no sudden thrusts or anything. But this one, what I'll just do is let that go. And mobilize deep in there. You feel that? Good. And now we go right back over here. We opened it up a little bit, huh?
Feel it.
Still hurts pretty good though?
Yes.
Okay, now I actually am going to do a little bit of a thrust adjustment.
Okay.
Good. All right, good. How does it feel right there? Any better?
Still feels a little tight on the right side.
Okay. All right, now we go into muscle tests of the lower half. So I'm going to push your knee down like that. Don't let me do that. Ready? Go. Not so good, huh? Pushing down. Don't let me. Ready? Go. A lot stronger. Okay, so we're going to adjust that. What just tested weak with some of your hip flexors. So what we're going to adjust here is the L2 segment, because the nerve roots that come out of that L2 segment are what control your hip flexors, okay?
Mm-hmm.
So that's right here. Take a deep breath. Breathe on out. Very good.
Ow!
I'm sorry for laughing. Okay, very good. The hip
Even
flexion.
laying down feels nice and balanced now.
Good. All right, I'm going to push down. Don't let me do that. Ready? Go. Much better, yes?
Yes.
Okay, now I want to flip you around on your belly, and we're going to check a couple of other things about how your posterior chain is firing, okay? Good. That hurts right there.
So ass. It's like...
Yeah. All right, muscle test. I'm going to push down like that. Don't let me do that, okay? Ready? Go. Very good. This guy, pushing down. Don't let me go. Again. Not so good, huh? All right, so we got to adjust that. Hear that? I don't like it. Breathe out.
Ow!
I think we get rid of that again. You alright?
Mm-hmm.
There you go. Breathe out. Very good.
Mm-hmm.
Muscle test. I'm pushing down like that. Don't let me. Ready? Go. Much stronger,
God.
yeah?
And I feel my hammies.
Yeah, good. Okay, raise your knee up. Hold it up right there. I'm going to push your knee into the table. Go. That hurt?
Yes.
Where did it hurt?
Right here.
In the low back. Okay. Raise up here. Hold it right there. Pushing down. Don't let me. Very strong. We're going to check this one more time. Hold it. Yeah. Way weak, huh?
So
Okay.
that's where that frustration comes in.
Yeah. Okay. So what we're going to do is go release some of your glute muscles and external rotators. I'm going to go right here into some of these muscles that are too tight in your hip.
Okay.
Okay, and I think one of the things that's happening is these muscles are so tight that your hip isn't moving normally. And since your hip isn't moving normally, it's recruiting all this stuff to move way too much, and that's why you're not feeling so great. So I'm going to grab here. When I say so, I want you to lock out your leg, kick forward and towards the floor diagonally, and you go as far as you can. And you don't even like that already, huh?
Hammy screaming.
Uh-huh. Go for it. Good. Come on back. And go. Good. Come on back. Again, go. There we go. What just popped?
My hip.
Hip?
Mm-hmm.
Again. Does it pop like that a lot?
So good, yes.
Go for it. Good. And again. Way looser. Last one.
It would feel release right here.
Yeah?
Yeah.
Cool. All right. Okay. You all right? Raise your knee up. Hold it right there, pushing down. Much stronger, yes?
Yes.
Did it hurt?
No.
All right. Beautiful. Is it still screaming at the same rate? No, because you're stabilizing through your core and your spine. That first exercise that we had you do, the 90-90 exercise, but we added another component, didn't we, with the kettlebell? You've actually done 90-90 exercise before, correct?
I have, yeah.
All right, and then how did it change things once we added that weight?
It definitely aligned me in such an easy way where I felt less tension on the right and left hip.
Uh-huh.
So it positioned me in a way where my body felt comfortable enough. I was able to settle into it easier, which is crazy because you hand me a 20-pound kettlebell and you'd think that that was restriction for my body because it was before.
Yeah.
And now it's just open.
Right. Holding that weight can really turn on all sorts of stabilizing forces with your core and your torso. So once those are turned on, suddenly your hips are able to move a whole lot better and looser. So that's great. Perfect. Beautiful. Yeah, notice all these balance muscles and stabilizing muscles. That second movement we had you do was marching with one kettlebell just on the one side in the rack position. What was that like for you?
Definitely feel the weak side, my right side. Whenever I was balancing on my right side, I felt a little bit more, had to think about it a little bit more.
Yeah, you had to bring your focus to it.
I had to think about it a little bit more. But then on my way back, just focusing on the breath again, and utilizing that same concept, finding your balance, I felt a little bit more strong.
Okay, perfect. Go for it. Whoa! Perfect. Okay, so now we've activated all sorts of stabilizing forces of your hips into flexion, into extension, rotational stability. So what I want you to do is get into Warrior 3 pose. What was it like being able to get into the Warrior 3?
That was awesome. Thank you. I was able to step forward a little bit more, which to me, I'm like, whoa.
Mm-hmm.
My foot was able to go forward a little more in that Warrior 3, which in hand allowed me to sink into it more,
Awesome.
which is magical.
Yeah.
It's amazing.
Come on out of it.
Thank
Way
you.
to go.
So that was your treatment. What did you think?
I feel good. Thank you.
Yeah,
Yes.
good.
Nerve-wracking for the neck, but definitely needed it.
Yeah. Overall, what are your opinions on what you just went through versus what you remembered chiropractic to be, or what others have told you?
I just really want to say thank you for making me feel comfortable in the process. It is a little bit of you step into fear walking in. You know, you don't really know what's going to happen. You're being vulnerable and you're putting yourself out there, but because of the approach in which, you know, your knowledge and you talked about everything that you were about to do, how do you feel? It just makes you the experience a little bit more comfortable for me to trust. And in that way, the body kind of relaxes a little bit more and it works efficiently.
Yeah, absolutely.
Yeah.
So you can find Karen and train or do yoga with Karen. You can find her on Instagram, also at the Delray Beach Boxing Club. Tune in for our next Treatment Tuesday. Don't forget to leave a comment below and hit the subscribe button, and we'll see you next week.